You know how it is in those medical dramas, like the second someone's in trouble,
Yeah,
they slam an IV in them? It's instant healing juice, you know?
right.
Lights dimming,
Right.
someone yells, "Get me an IV, stat!" And boom, crisis averted.
Exactly.
But I gotta say, I kind of have a feeling it's not quite as simple as they make it seem in Hollywood.
Yeah, you know what? You're right. I hate to be the one to tell you, but it's not quite as simple as the movies make it out to be.
And that is what we are diving into today.
Okay.
The surprising truth about IV fluids.
I like it.
Turns out, our understanding of when they help
Mm-hmm.
and when they harm, it's really gone through like a major shift,
Yeah.
especially lately. And we've got two incredible medical journal articles that are going to be guiding us through this. The latest clinical guidelines from the European Society of Intensive Care Medicine,
Nice. Yeah.
and another one that really digs into this less is more approach to fluids.
Right. So for a long time, we had this thought like more fluids is better, right?
Yeah.
Especially when we're talking about emergencies. But what's fascinating is these articles, they point to like a fluid paradox.
A paradox. Now you've got me really curious. What is that all about?
So what we're seeing now is that in many critical illnesses, a more conservative approach, meaning like giving less fluids rather than more, might actually be giving us better outcomes for our patients.
Really? That's so counterintuitive. That's like saying don't drink too much water when you're exercising really hard. So why is that? What's the science behind this whole paradox?
So you have to think about it like this. When our body goes into like crisis mode, it doesn't deal with fluids the same way it does when it's just, a normal day.
Right.
And if we overload the system, we can actually dilute our blood's ability to carry oxygen.
Wow.
So imagine that you're trying to deliver something that's life-saving in a truck, but the truck is just overflowing with all this stuff that you don't really need.
Yeah.
It's going to slow down the delivery rate.
Yeah. So instead of helping the body heal, we're actually hindering it by giving it too much.
Precisely. And not only that, but then you have to think about fluid overload putting a strain on vital organs,
Yeah.
like your lungs
Okay.
and your kidneys. And that's especially a problem when we're talking about something like ARDS,
Okay.
acute respiratory distress syndrome, where the lungs are already having a hard time doing their job. And then we're giving extra fluid, and it's just making it even harder.
It's almost like trying to put out a fire with like gasoline.
That's a good way to put it.
And you mentioned kidneys too. How did this impact our kidneys?
So think about your kidneys as filters.
Okay.
Right. All day long, they are working to clean out all the waste products, all this extra fluid in your blood.
Right.
And if we're overloading them with fluids, they have to work overtime.
Yeah.
And just like anything, like if you work too much, you get kind of like run down.
Burned out.
Yeah.
Yeah.
And that can lead to something called acute kidney injury, or AKI,
Okay.
and that can further disrupt this delicate balance.
So what we're doing is like what we think is a good thing can actually turn into a bigger problem.
Exactly.
If we're not careful, it makes you realize like how important it is to look at each patient
Yes.
and really understand how their body is responding to these fluids, because it's not just like a one size fits all.
100%.
Yeah.
Not everyone benefits from IV fluids equally. And we really need to think about the risks and make sure that they outweigh the benefits. And this is actually a key point that these guidelines from the ECCM talk about,
Okay.
which are basically like the rule book for intensive care in Europe. And they're moving away from saying, oh, this is what we do for everyone, for certain patients, especially when it comes to fluids.
So what was once considered like standard practice is now being questioned in a lot of ways.
The guidelines are getting a lot more specific, like when is it appropriate to give a lot of fluids? And when do we need to kind of back off and be a little more cautious? And we're seeing that with things like sepsis,
Right.
acute respiratory failure, even, sometimes even in the OR.
And speaking of sepsis, that seems to be a big topic in all this.
Absolutely.
That this approach of giving lots of fluids early is really being questioned.
Yeah, and for good reason.
Yeah.
Because studies, like the Andromeda shock trial, are showing that, the longer a patient with sepsis is in the ICU, the less likely they are to actually benefit from us giving them these tons of fluids.
It's almost as if, like, over time, the body loses its ability to use those fluids effectively.
Yeah.
Like it's saying enough is enough. I can't process this right now.
You got it.
Yeah.
And then another study, the Clovers trial, they actually looked at giving less fluid versus more fluid in patients with sepsis.
Okay.
And guess what? They found that there was no difference in who lived or died
Wow.
between the two groups, which really challenges that thought that we always have to give a ton of fluids for sepsis.
So if aggressive fluids aren't always the answer, what are some of these new strategies?
So one that's looking very promising is actually using medications called vasopressors
Hmm.
early on. And what these do is they actually work by tightening up the blood vessels.
Okay.
And that can help to increase blood pressure without us having to rely on giving tons of 5E fluids.
Hmm.
So it's about finding that balance
Yeah.
between making sure the blood pressure is okay and not causing more harm by giving too much fluid.
It's like we're trying to find that sweet spot, you know?
Yeah.
Enough to support the body, but not so much that it backfires.
Absolutely.
We've talked about sepsis, we've talked about ARDS.
Right.
But what about some other conditions where this whole less is more approach is coming up? What about acute pancreatitis? I know that fluid management's like a big deal there too.
Oh, it absolutely is. So in acute pancreatitis, the pancreas, which, helps us digest our food, it gets inflamed.
Mm-hmm.
And
Yeah.
you would think, okay, so giving more fluids would help kind of dilute those enzymes and calm things down, but it can actually increase the risk of something called abdominal compartment syndrome.
Okay, time out for a second. Abdominal compartment syndrome. That sounds pretty intense. What is that?
So picture this, okay? Your abdomen is like a container.
Okay.
And it's holding all your organs, right?
Right.
And so when there's too much fluid in that container,
Yeah.
it's putting pressure on everything inside.
Oh, wow.
And that pressure, it can restrict blood flow to those organs,
Oh.
leading to some serious complications.
It's like, overfilling a balloon.
Yeah.
Eventually it's going to pop.
Exactly.
So this more conservative approach kind of helps prevent that from happening.
You got it. By being really careful with how much fluid we give, especially early on, we can really help avoid that.
It's just incredible to me how, something like fluid balance
Yeah.
can have such a big impact on
Yeah.
our health. And we talked a bit about acute kidney injury earlier.
Right.
AKI.
Yes.
Can you tell us a bit more about how fluids play into that condition?
Yeah. So AKI is when the kidneys all of a sudden just can't do their job.
Yeah.
And remember how I said they're like filters, right?
Yeah.
So when they're injured, they can't filter that waste and that extra fluid from the blood.
Right.
And so here's the thing. Here's the catch. Fluid overload can actually cause AKI,
What?
but it can also make it worse.
Oh, no.
It's like this vicious cycle.
So it's this double-edged sword. It can lead to retaining more fluid,
Exactly.
which makes the problem even worse.
Exactly.
And this is where careful fluid management, especially in these patients,
Oh, for sure.
is just absolutely critical.
Absolutely. So by minimizing the fluid overload, we're giving the kidneys a fighting chance to get back to doing their job.
This all makes so much sense.
Right.
But is there a way, a simple way to summarize this whole approach
There is.
to IV fluids,
Yeah.
like a framework that we can kind of use?
So one of the articles we were looking at, it talks about the 4Ds of fluid management.
Okay.
And they compare it to how we think about using antibiotics, which I
Right.
think is really helpful.
Okay, I like a good mnemonic device.
Right.
So hit me with these 4Ds.
Okay. So just like with antibiotics, we need to think about drug.
Okay.
So in this case, what kind of IV fluid are we using?
Okay.
Dose. How much are we giving? Duration. For how long are we giving it? And then the last D, de-escalation,
Okay.
which is knowing when to back off.
Oh, wait.
Especially as that patient's status is changing.
Yeah, it's not just about grabbing the first bag of saline and,
Back,
yeah.
going to town.
Exactly. There's a lot more to it now.
So tell me about that. Saline's really common,
Very common.
but I've also heard about these things called balanced crystalloids. Right, so balanced crystalloids, they're designed to be closer to the natural balance of electrolytes in our blood.
Okay, wait. Break it down for me. Electrolyte balance. What are we talking about?
So electrolytes, those are minerals, right? Like sodium, potassium,
Yeah.
chloride, all those things that we need for our body to work.
Yeah.
They help with things like our nerves firing, our muscles contracting, even just keeping the right amount of fluid in our bodies.
Gotcha.
And when we give a ton of saline, it can actually throw those electrolytes out of whack.
Okay.
And so balanced crystalloids are made to try to avoid that.
So it's instead of just drinking water after you work out,
Yeah.
you have a sports drink that's got electrolytes to replace what you've lost.
100%.
Mm-hmm.
That's a great way to think about it. It's about replenishing,
Yeah.
not just adding volume.
Right, what our body actually needs.
That's right.
Okay.
Right.
So are these balanced crystalloids always the better option then?
So that's where it gets a little, we've got to be careful.
Okay.
Because even though it makes sense in theory, when we look at the research, it's kind of all over the place.
Okay.
Some studies say, oh, yeah, they're great, especially for, sepsis patients or people who might have kidney issues.
Right.
But then we have these big studies
Yeah.
that don't really show that they're like clearly better than saline when we're looking at really important things like, did they survive? Did they not develop kidney injury? Things like that.
So it's not as easy as just saying one is better
Right.
than the other.
And then you have to think about other things too, right? Like how much do they cost? Because a lot of times these balanced crystalloids are more expensive. And that can be a really big deal, especially in areas where, they don't have as many resources.
Yeah. Cost is always something that we have to think about.
Oh, absolutely.
Okay, so we've talked about saline, balanced crystalloids. What about this thing I've heard of, albumin? Where does that fit in?
So albumin is a protein
Okay.
that's naturally found in our blood. And it's kind of like these little sponges
Okay.
that help keep the fluid inside the blood vessels.
Oh, wow.
So that helps us maintain our blood volume.
I see.
And we can give it through an IV. A lot of times it's concentrated to help restore that blood volume if it gets really low.
So it's like giving our body a little extra help.
Yeah.
With that fluid balance.
Exactly.
When would you typically use something like this?
So we often use it in cases of hypoalbuminemia,
Okay.
which just means that their albumin is low.
Gotcha.
And we see this with things like really bad burns, liver disease,
Yeah.
where the body's just not making enough albumin.
Right.
Or maybe they're losing it too quickly.
So we need to replace it
Yeah, we got to put it back in.
to help the body hold on to those fluids.
Exactly. It's a more targeted approach.
It seems like this theme of individualizing treatment that's coming up again and again. There's no one right answer for everybody.
Right, absolutely. And these articles really, really stress that we're moving away from just these set protocols to what's going on with this person and what do they need in this moment.
Yeah.
We're going away from more is always better and towards what is best for you.
And that's got to be really reassuring for people to hear.
Right.
Because it can be scary when you're dealing with a medical crisis. So for those people who are listening who are facing that themselves or maybe have a loved one who's in the ICU, what are the big takeaways here for them? What does this all mean?
I think the biggest thing is that we need to start thinking about IV fluids a little differently.
Yeah.
Because they're not always as harmless as we think they are.
Right.
They can be life-saving, absolutely, when used the right way, but they can also have these unintended consequences, especially if we're not being really careful about how we're giving them.
Yeah, it's not like in the movies
No.
where you get the IV and everything's better.
Exactly. There's a lot more to it.
It's important to ask questions. Don't be afraid to be involved.
In those medical decisions.
Yeah.
If you or a family member's in the ICU, ask about the plan for the fluids. Why are they using this one? What are the risks? What are the benefits?
That's where, that communication
Yes.
between you and your medical team is so critical.
It's huge.
Yeah.
And along those lines, don't be afraid to say something.
Yes.
If you notice that, maybe they're getting too much fluid. Are they swelling? Are they having trouble breathing? Has their urine output changed?
Yeah. Those are all really good signs to watch out for.
Tell somebody.
Yeah, be your own advocate.
Exactly. Knowledge is power. The more you know, the better you can advocate for yourself or your loved one.
100%. So we're not just passively accepting what's happening. We're actually taking part in our care.
We have to be involved.
Exactly.
Yeah.
This has been so eye-opening.
It's fascinating, isn't it?
It really is. It's amazing to me how something like fluids can be so complex.
It seems so simple, right?
It does. We think about it every day.
Exactly. But this is what I love about medicine.
Yeah.
We're always learning what we thought we knew can change.
Yeah.
And that's a good thing. It means we're getting better at what we do.
It's like they say, the only constant is change.
That's right.
And hopefully that leads to better care for everyone.
Absolutely. And I think this whole shift in how we think about IV fluids, it's a perfect example of that. It's about being open to these new ideas, new research, new ways of doing things.
Well, there you have it, everybody. We've reached the end of another deep dive. We really got into it with IV fluids.
We did.
We debunked that myth that more is always better. And I think most importantly, we learned about the power of really personalizing medicine.
Absolutely.
Even when it comes to something as basic as hydration.
We hope that you learned something new today.
Yeah.
And that you feel a little more ready to ask those questions.
Yeah.
Stand up for yourself or your loved ones.
Yeah.
And maybe even think about your own hydration habits a little differently.
You never know what you might learn. So, as always, Thanks for diving in with us.
See you next time.
It makes you think. We've been talking about this less is more approach
Right.
with IV fluids when
Yeah.
it comes to like these really serious illnesses, right?
Yeah.
But it kind of makes you wonder about
Yeah.
could this apply to less severe situations? Even just our everyday lives.
Yeah.
We're always hearing about staying hydrated, drink 8 glasses of water a day,
Right.
guzzle those sports drinks when you exercise.
Absolutely,
It
yeah.
makes you wonder,
It does.
are we overdoing it sometimes?
Well, and that's what's so interesting, right? Because the research that we're looking at, it's all about really, really sick people.
Yeah.
But you're right, it does make you stop and think about how we approach just like regular hydration.
Right.
Because, at the end of the day, our bodies are always trying to keep that balance,
Right.
whether we're, in the hospital or just going about our day.
So maybe, chugging gallons of water isn't the answer,
Right.
but we still need to be mindful
Yeah.
of getting enough fluids.
Absolutely. It's about finding that middle ground.
Right. That balance.
Yeah.
That's what it's all about.
And just like with the IV fluids, right?
Yeah.
Like we were saying, there's no one size fits all.
Mm.
Our bodies are different. So, how much we move around, the weather,
Right.
even just like how our own individual bodies work.
Right. Our metabolism.
Exactly. That's all going to play into how much we need.
I think it's easy to forget to just listen to our bodies,
Yeah.
Like sometimes you're thirsty, you drink, but sometimes we need to be a little more aware,
Right.
especially if we're out in the heat,
Absolutely.
we're being super active.
And pay attention to those cues, right?
Yeah.
Because a lot of times our bodies will tell us.
Right. What's going
If
on?
you're feeling tired, if we get a headache, maybe we're a little dizzy, muscle cramps even. Those could be signs that we just need to drink something.
This has been really eye-opening, I gotta say.
It's fascinating stuff, isn't it?
It really is. I mean, it's amazing to me how something like fluid,
I know.
it seems so simple.
Right. It's just fluids.
It's just fluids, right? We deal with it every day.
Exactly.
There's so much to learn.
so much.
So much complexity to it.
And that's what I think is so cool about medicine,
Yeah.
is that we're always discovering new things.
Mm-hmm.
What we thought we knew can change.
Right.
And that's good. It means we're getting better.
Right. And hopefully
Yeah.
that means better outcomes
Yeah.
for the patients.
For everybody.
It's like they always say, the
Yeah.
only constant is change.
That's true.
And in this case, it seems like those changes are leading us towards a better understanding of how to use IV fluids safely and effectively.
It's about keeping an open mind, being willing to say, maybe what we thought was right isn't always the case. Always questioning, always learning.
Well, folks, there you have it. Another deep dive in the books.
Another one down.
We really got into it with IV fluids today.
We did. We sure did.
We debunked some myths. We learned about the importance of individualizing treatment,
Absolutely.
even when it comes to something as essential as hydration.
So we hope you learned a lot today, that you feel a little bit more confident to ask those tough questions, advocate for yourself, advocate for your loved ones, and maybe even, like I said, approach your own hydration a little differently.
Knowledge is power, everybody. The more you know, the better you're able to really take charge of your health
Absolutely.
and make the best decisions for you
100%.
and your loved ones.
Couldn't have said it better myself.
As always, thanks for diving in with us.
See you next time.